Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. I've been feeling pretty overwhelmed with managing all my conditions, especially with the recent issues I've had getting the right medications delivered.
Good morning, John. I understand that must be frustrating. Can you tell me more about these issues?
Well, last month I received an excess of my cholesterol medication, simvastatin, but they forgot to send my gabapentin. I had to call and sort it out, and it took a week to get my medication. During that week, my neuropathy symptoms were almost unbearable.
That sounds very challenging. How have your neuropathy symptoms been since you received your medication?
Since I started back on the gabapentin, it's been manageable, but every now and then I get these intense spikes of pain. It's unpredictable.
I see. How about your other conditions? How are you managing your high blood pressure and your exercise routine?
My blood pressure has been sort of stable, but I still feel it spikes, especially when I'm stressed. As for exercising, I've been trying to go to the gym regularly. I swim, use the treadmill, and I've lost some weight, which I'm really happy about.
Losing weight is excellent progress, John. That's very good for your heart and blood pressure. How has your experience been with quitting smoking?
That's been tough. I still smoke occasionally, mostly when I'm stressed or feeling down. I know it's bad for me, especially with my heart history.
It's good that you're aware and making efforts. Shifting topics, how has your experience been with the CPAP machine?
To be honest, I don't use it as often as I should. It's uncomfortable, and I find it hard to sleep with it on.
Understood. Let's also talk a bit about your psychological health. How have you been managing your PTSD and anxiety?
I try to keep busy, which helps, but there are days when I just feel it all crashing down on me, and it's hard to get out of bed. The memories from my service time, they sometimes come back vividly.
Thank you for sharing that, John. It's important to address these feelings as they are crucial to your overall health. Now, let's go over some of your recent test results and see where we stand.
Please.
Your blood pressure today is 140/82 milligrams, which is a slight improvement. Your heart rate is stable at 78 BPM. You've done well with your weight management, currently at 277 pounds. Your recent lab tests show your fasting blood glucose at 102 milligrams dinner and your A1C at 5.8%, which are indicative of prediabetes. Your cholesterol levels are within a manageable range, but your LDL could be lower.
I see. What do we do going forward?
First, we'll make sure your medication deliveries are on schedule and correct. I'll have our nurse double-check with the pharmacy. Regarding your blood pressure medications, considering your current levels and the stress factors, I think maintaining the current regimen of lisinopril, amlodipine, and hydralazine is appropriate. We will also continue with simvastatin for your cholesterol.
And the pain spikes.
For your neuropathic pain, we'll continue with gabapentin. If the pain persists, we might consider adjusting the dosage. It's also essential to keep managing your weight and incorporating exercise as much as possible.
Got it? Anything else?
I would strongly recommend revisiting the use of your CPAP machine. It can significantly improve the quality of your sleep, which in turn might help with your weight and overall mood. Lastly, it might be beneficial to consult with a counselor or psychologist to address your PTSD and anxiety, especially on those tougher days.
Thank you, Dr. Carter. I appreciate the thorough rundown and the plans going forward.
You're welcome, John. Let's schedule a follow-up in 3 months to reassess your condition. I'll also arrange for lab tests before your next visit to monitor your cholesterol and glucose levels more closely.
Sounds good. Thanks again for your help.
Of course. Take care, John. We'll work on this together.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. Let's discuss how you've been feeling recently and any updates on your symptoms or changes in your health.
Good morning, doctor. I've been pretty uncomfortable lately. My mouth is really dry all the time. It's making it hard to sleep and even messing with how food tastes. I stopped the loratadine like we talked about last time, but I'm not sure it's made much difference yet.
I see. How long has it been since you stopped the loratadine?
It's been about a week now.
Okay, it might take a little longer to see if that was the cause. Tell me more about the other symptoms you've mentioned.
Well, the knee pain is just as bad as before. It's swelling up a lot more recently, and it feels like it might be similar to what happened with my other knee before the surgery. And there's the cough. It's dry, but sometimes I cough up blood in the morning. That's been worrying me a lot.
Have you noticed any patterns or specific triggers for the cough, or is it pretty constant?
It's mostly in the morning or after a cigarette. I'm still smoking, about half a pack a day.
Okay, we'll need to keep an eye on that, especially with the blood. Now, you mentioned scrotal pain as well. Could you elaborate on that?
Yes, it's been quite severe. It's a sharp pain, sensitive to even light touches. There's no swelling like last time, but it's very uncomfortable. I've started the ciprofloxacin again, as we discussed.
How long have you been back on the ciprofloxacin, and have you noticed any improvement?
I started it 3 days ago. The pain is still there, but maybe a bit less intense.
All right. You also mentioned that you've been experiencing some mental health challenges?
Yes, I've been feeling really stressed and anxious, more so lately, with all these health issues piling up. I haven't taken clonazepam in a while, though I saw my psychiatrist last month.
It's important to manage that stress, as it can impact your overall health. Let's make sure to keep your psychiatrist in the loop with our treatment plan. Now, considering your family history and your current cholesterol levels, How have you been managing your diet?
I try to eat well, but I haven't made any big changes recently. I know I should cut down on the cigarettes and maybe the alcohol.
That would be beneficial, especially for your lung and heart health. Let's go over the results of the tests and imaging we did last time. Your cholesterol is on the higher side, which is a concern given your family history of prostate cancer and your current heart rate and blood pressure readings. Your basic metabolic panel and liver function tests look normal, which is good. The chest X-ray didn't show any active disease, and the knee X-ray showed moderate joint space narrowing, but no acute fractures.
What are the next steps then?
Given your symptoms and the test results, here's the plan. We'll continue to monitor your response to stopping loratadine for the dry mouth. I'm starting you on metoprolol to help manage your blood pressure and heart rate better. It should also help reduce any additional strain on your heart from your smoking, though I strongly advise you to cut down or quit. We'll continue the ciprofloxacin for now to fully address your scrotal pain, assuming it's an infection. I would like to do some follow-up lab work, including checking your cholesterol and potassium levels again. We also need imaging for your knee to evaluate the need for potential surgery.
Sounds like a plan. I appreciate your help, doctor. It's a lot to manage, but knowing what we're dealing with helps.
Absolutely. I'm here to help you through this. We'll schedule a follow-up appointment in 2 weeks to review everything. In the meantime, please don't hesitate to contact us if your symptoms change or if you have any concerns. Take care and see you soon.
Thank you, doctor. See you in 2 weeks.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I've been reviewing your latest test results, and I've noticed some changes that we need to address. Your blood pressure and kidney function levels have shifted slightly.
Is that bad? What does it mean for my overall health?
It's not unexpected given your condition, but it means we need to adjust your treatment to manage these changes better. It's part of the disease's progression, and staying ahead is crucial.
Okay, what kind of adjustments are we talking about?
First, we might tweak your medication doses. Also, incorporating more specific dietary restrictions could help manage your symptoms more effectively.
I understand it's a lot, but I'm glad we're keeping track of everything.
Absolutely. It's important to monitor these changes closely. I'll schedule another set of tests in a few months to see how our adjustments are working.
Now look at question 26.
During your pregnancy, it's vital to focus on nutrition and regular prenatal checkups. Are you currently taking any prenatal vitamins?
Yes, I started taking them as soon as I found out I was pregnant. What else should I be doing?
That's great to hear. It's also important to stay hydrated and maintain a balanced diet rich in calcium, iron, and folic acid. Have you had any issues with morning sickness or other health concerns recently?
Some morning sickness, but nothing too severe. Should I be exercising as well?
Yes, moderate exercise is beneficial. It helps with your mood and stamina and can even improve sleep, but it's essential to choose safe activities designed for pregnancy.
Thank you. That's really helpful. I want to make sure I'm doing everything right for my baby.
You're doing a great job. Just make sure to keep your regular appointments so we can monitor both your health and the baby's development closely.
Now look at question 27.
I see that this information is a bit overwhelming. It's a lot to take in all at once.
Yes, I'm trying to understand everything. So the medication will help manage the symptoms but not cure the condition.
That's correct. The goal of the treatment is to help you manage symptoms better and improve your quality of life. It's okay to have questions about this.
And these side effects, how likely am I to experience them?
Side effects can vary widely among individuals. We'll start with the lowest dose and closely monitor your response. It's all about finding the right balance for you.
I appreciate you taking the time to explain things clearly. It helps to talk it through like this.
Of course, I'm here to help you through this journey. Let's take it one step at a time. Feel free to ask anything, whenever you need.
Now look at question 28.
The new protocol might increase the risk of nausea and dizziness in some patients. We need to consider how we'll manage those side effects.
Agreed. For nausea, we could consider prescribing antiemetic drugs as a preventative measure for those who are at higher risk.
Good point. For dizziness, monitoring blood pressure and hydration levels could help mitigate some of the risks. It's important to prepare the nursing staff to handle these situations.
I also suggest adding a patient education component about these potential side effects so they know what to expect and when to seek help.
That's a great idea. An informed patient is better equipped to manage their care. Let's put together some information sheets and review them at our next meeting.
Now look at question 29.
I've been looking into wearable technology that can help us monitor your neurological condition more effectively. Have you heard about these devices?
I've read a little about them. Do you think it's something that could help with my condition?
Definitely. These devices can track your activity, sleep quality, and even detect changes in your condition before you're aware of them. It could give us a lot of useful data.
That sounds innovative. Is it comfortable to wear, and how accurate is it?
They're designed to be very user-friendly and comfortable, and the accuracy has improved significantly with the latest models. I think it could really benefit your treatment plan.
I'm open to trying it. Anything that can help provide better insights into my condition is worth considering.
Great. I'll get the necessary paperwork started, and we'll set up a follow-up to see how you're adapting to the device.
Now look at question 30.
Now that you're entering the postpartum period, it's important to take care of yourself as well as your baby. Are you familiar with the medications and supplements recommended during this phase?
Somewhat, but I could use some clarification. What should I be taking?
You'll need to continue your prenatal vitamins, especially if you're breastfeeding. Additionally, it's important to monitor for any signs of postpartum depression, as it can often be overlooked.
I've heard about that. How will I know if it's more than just normal mood swings?
That's a good question. If you find your mood impacting your ability to care for yourself or your baby, or if the feelings persist beyond a couple of weeks, it's important to seek help.
Thank you for letting me know. It's reassuring to have support during this time.
Absolutely. We're here to support you every step of the way. Don't hesitate to reach out if you have any more questions or need assistance.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Hello, everyone. Today I'm thrilled to have Dr. Todd, an associate professor of medicine at Harvard Medical School. Dr. Todd is also one of the authors of the new 2022 Standards of Medical Care in Diabetes. Dr. Todd, welcome to the show.
Thanks, Alex. It's great to be here, and I'm excited to discuss the new guidelines.
We appreciate you taking the time out of your busy schedule. First off, could you describe the process of creating the ADA's guidelines? It's fascinating that your organization updates them annually.
Absolutely. It begins with our Professional Practice Committee, which is a diverse group of experts, from endocrinologists to cardiologists. They conduct an exhaustive literature review of new studies and data since the last publication. They work in subgroups, each focusing on their area of expertise within diabetes care. The process involves vigorous debates and discussions until a consensus is reached on the new recommendations, which are then published in Diabetes Care.
That sounds incredibly thorough. Now, one of the hot topics in this year's guidelines is the recommendation for universal screening for diabetes and prediabetes starting at age 35. Could you expand on the rationale behind this change?
Certainly. The rise in diabetes cases among younger populations and the significant number of undiagnosed cases were major factors. For those with obesity or other risk factors, screening should start even earlier, possibly at age 18. This aligns closely with the guidelines from the U.S. Preventive Services Task Force.
Shifting gears a bit, another major advancement has been in the field of comorbidities, particularly the link between diabetes and severe outcomes from COVID-19. Could you touch on the importance of vaccination for individuals with diabetes?
Diabetes has sadly seen a disproportionate impact from COVID-19, with severe outcomes being more common. While people with diabetes aren't more susceptible to contracting the virus, their risk of severe disease is considerably higher. Vaccination is strongly recommended for individuals with diabetes, as they were well represented in the vaccine trials, confirming safety and efficacy.
With the rapid advancements in diabetes care, technology plays a pivotal role. Could you discuss the current state of technology in diabetes management, especially the use of continuous glucose monitors, CGMs?
Technology has truly transformed diabetes management. The current recommendation is for all insulin-using individuals, regardless of age or diabetes type, to consider using CGMs. They provide significant improvements in managing blood glucose levels, especially overnight. The technology is also evolving to facilitate better management during meals and activities.
That's fascinating. As we wrap up, are there any final thoughts or major updates from the guidelines that you'd like to highlight?
One area we haven't touched on much is the intersection of liver disease and diabetes. It's becoming increasingly prevalent as liver disease often accompanies type 2 diabetes due to common risk factors like obesity. There's promising research showing that certain medications can positively impact liver health in people with diabetes. Additionally, we're focusing on the impact of cognitive decline in diabetes, advocating for simplified medication regimens, improving compliance and safety for those affected.
Dr. Todd, thank you for such an insightful discussion. It's clear that the field of diabetes care is rapidly evolving with significant emphasis on personalized care and technological integration. We'll be sure to link to the ADA's resources on our podcast page for our listeners who want to dive deeper.
Thank you, Alex. It was a pleasure discussing these important updates, and I hope your listeners find the resources helpful in their practice and personal management of diabetes.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, we will delve into the nuances of preventive cardiovascular care, particularly focusing on the use of aspirin for primary prevention of cardiovascular events. This discussion is crucial as it affects clinical decisions for a broad segment of the population. Aspirin, traditionally used for its antiplatelet properties, has been a staple in cardiovascular disease management. However, recent guidelines have adjusted our approach, especially concerning its role in primary prevention, preventing heart attacks and strokes in people without previous cardiovascular events. To contextualize our discussion, let's consider a case study. We have a hypothetical patient, Mr. Smith, a 65-year-old male with type 2 diabetes and hypertension, but no history of cardiovascular disease. His calculated 10-year cardiovascular disease risk is about 12%, placing him in a category where aspirin use could be considered. Historically, aspirin was widely recommended for individuals like Mr. Smith. However, evolving evidence suggests that the benefits of aspirin in primary prevention are closely balanced with the risks, particularly bleeding. This shift is highlighted in recent studies, such as the ARRIVE, ASCEND, and ASPRI trials, which have informed the latest recommendations from the U.S. Preventive Services Task Force. The ARRIVE trial explored aspirin's efficacy in individuals at moderate risk of cardiovascular events and found no significant benefit in reducing the risk of major cardiovascular events, but noted an increased risk of bleeding. Similarly, the ASPRI trial, which focused on an elderly cohort of 70 years and older, indicated no benefit in reducing cardiovascular events or mortality, but showed an increased risk of major hemorrhage and even suggested a potential increase in mortality, which was a significant concern. In Mr. Smith's case, given his age and risk factors, the new guidelines would recommend against initiating aspirin for primary prevention. The decision-making process should involve a detailed discussion about the potential benefits and risks. For instance, while aspirin might offer a marginal decrease in the incidence of non-fatal myocardial infarction, this benefit must be weighed against the increased risk of gastrointestinal bleeding and hemorrhagic stroke. Furthermore, it's essential to consider alternative strategies for cardiovascular risk reduction. Statins, for instance, have a more favorable risk-benefit profile in many cases and are recommended for managing cholesterol levels in patients with diabetes like Mr. Smith. Blood pressure control, another critical factor, can significantly reduce the risk of cardiovascular events, and lifestyle modifications such as diet and exercise remain foundational. In practice, this shift away from aspirin for primary prevention emphasizes a more personalized approach to cardiovascular risk management. Each patient's risk factors and overall health profile must be considered in making preventive treatment decisions. For Mr. Smith, focusing on comprehensive risk factor management and potentially considering other pharmacological interventions would likely provide greater overall health benefits than starting aspirin. The role of aspirin in primary prevention of cardiovascular disease has become more nuanced, reflecting a broader trend towards individualized patient care. It's a potent reminder of the importance of staying updated with the latest research and integrating multiple aspects of care in managing cardiovascular risk. For healthcare providers, ongoing education and patient engagement are crucial in navigating these changes effectively.